Hi everyone, welcome to Max Moms. This is part 2 of a 2-part series. And this part, I am so excited. We're going to go all into labor and different birth options and what to expect with those, certain questions to answer. And then we're also going to go into what's known as the 4th trimester, which is the postpartum period, and how to best take care of yourself and your baby during that time. So I'm very excited. We're going to jump right into it and start talking about the different options for birth. So there are 3 main options. Some of you may know about these, some of you may not, or if you have questions or concerns about them, hopefully I address those today. We're going to go over some of the pros and cons of each one and then what to expect. So the first one, as many of you can guess, is the traditional hospital OB/GYN birth. This is definitely the most common type of birth or choice for pregnant moms in America. So it's like 98.4%. And it's interesting when you compare America to other first world countries like Japan or the Netherlands. In those countries, women actually never expect to be medicated for birth. So, and I think why this is because unfortunately in this country, instead of pregnancy and birth being viewed as like a normal physiological process, it's viewed more as like a disease that needs to be treated. And there's a lot of like unnecessary steps or treatments that happen to moms throughout their pregnancy and then through the labor process as well. So that's kind of like the big difference there. But throughout history, labor and delivery was always done at home. So it was always where, one woman would go to another woman's house and support her during labor and help her through it. And it wasn't until around like the 1900s that childbirth started moving more from the home into the hospital. And then about the 1940s, it was about half and half. So half of women were giving birth at home and then half of women were giving birth at the hospital. And then it just started progressing to more and more women delivering at the hospital. And I think a big reason of this, or the reason why, is because fear and anxiety is huge when it comes to pregnancy and labor. Especially in this country, it's such a cultural thing to be completely terrified of pregnancy. And it makes sense if you look at, all of the media, and Hollywood is like a huge influence. Any movie you watch where there's a woman that's laboring, it's scary. It's like a very scary thing. And that is not how like a normal, healthy pregnancy and delivery or labor looks like. So I think a lot of women just have like an unrealistic expectation of what that's going to be, and then there's a lot of fear in place too. And moms are always going to try and do what they think is best for their baby, right? And for them as well, which I totally understand. But I hope tonight, my hope is to maybe instill a little bit more joy and excitement when it comes to laboring and bringing a life into this world. It's really like the most incredible thing. It's really hard to even put into words how incredible it is, and it should be something that we're excited about and not completely terrified of and anxious about. So hopefully I can help switch that mindset for some of you. We have really lost the faith in our bodies to be able to birth babies. And again, that's what I'm going to draw back to, having that trust in your innate intelligence. Your body has grown this baby over the last 9 to 10 months, and it knows exactly when and exactly how to deliver it. You just have to surrender to that process and let your body do its thing, which can be, a lot easier said than done, but that's the mindset. So I remember when I was young, I was completely terrified of birth, just from all the movies I had seen. And I remember saying oh, I'm gonna have a scheduled C-section because I just wanted to numb everything and I didn't want to have to go through that pain. But it really is such a mindset thing, and your body's absolutely capable of doing it. Women are literally created to birth babies. obviously not just birth babies. I'm an entrepreneur and a business owner, so we do other things, but like our bodies were created to birth babies and can do that very well. We just have to have that trust in it. So when it comes to the hospital, if you do decide to have a birth in a hospital, it is a lot harder to have like 100% natural vaginal birth. Not impossible. I know a lot of women that have done it, but it is a lot harder because one of the reasons is intervention is just really like literally right at your fingertips. Any time, like if some little thing goes wrong or you feel the slightest amount of like pain or pressure, you can easily, change your mind when it comes to intervention. So when it comes to hospital births, you really just want to make sure that you do your research. And then you ask the questions ahead of time when you're interviewing your OBs and knowing what the hospital's like regulations are, what your rights are. All of those things are so important when you go into that situation, because the last thing you want is to be surprised on the day that you're going into labor and the day that you birth your baby through that process. You want to have a lot of these questions answered ahead of time. So I'm going to go through some of like the main questions that you want to know before that. So the first one is knowing your OB's C-section rate. This is so important. So if you want to make sure that you also know the hospital C-section rate as well. So anything greater than 30%, like absolutely not. That means like 1 in 3 women are having a C-section. So if C-section is something you're wanting to avoid, you might want to maybe talk to another OB or go to another hospital that has a lower C-section rate. Some hospitals can even have like a 1 in 2. If you guys watch the movie Business of Being Born, it really opened my eyes to a lot of things that could potentially happen in the hospital. If you think about it, hospitals are a business and it's very efficient for them to get women in and out of the hospital as quickly as possible. And most of the time, labor is not a fast process. Usually. And so it's, as soon as you get to the hospital and you're in labor, unfortunately, like you're on a clock. And so C-sections are better for the hospital, right? Because they can do them very quickly and get the moms like in and out pretty fast. Unfortunately. So if you watch, The Business of Being Born, that's a wonderful documentary. It was actually made almost 20 years ago now, but it's very relevant today as well because things haven't really changed since then. So the second question I would ask, know your C-section rate. And then the second question I would ask is, how long will you let me go past my due date? I spoke about this a little bit in the first part, but a due date is just a guess. And a lot of the times it should be more of like a birthing window that you're, looking at of when the baby could potentially come. A lot of OBs, unfortunately, will want to induce you even if you're just like 2 days past your due date, which is kind of crazy because on average, like I said before, most women deliver 41 and 1, so 41 weeks, so a week and a day past their due date. And that's average. You could even go farther than that and still have like a completely healthy, normal baby. That is something you definitely want to do, because if you are induced, you can pretty much say goodbye to like a natural birth, because like typically they'll induce you with Pitocin, and what that drug does is it starts creating contractions for you. A normal contraction, they'll gradually get stronger and stronger. So you start off, like women can kind of like talk through them, and then they'll have, longer breaks in between, and then they start getting closer and closer together and like more intense, so that you're able to like build up to that. They will gradually increase. But with Pitocin, you are basically forcing the body into contractions, and these contractions are much more intense and stronger than any normal contraction or natural contraction would be without the medication. And so it can be like extremely painful for women, and a lot of times they need an epidural on top of that. So just knowing that, because if you do have to be induced and you want to do a natural labor, it's a lot harder. Again, not impossible, but much, much harder. Next question, how long will you labor for? So again, how long will you let me labor for? So when you're in the hospital, again, you are on the clock, unfortunately. So some of the women I know who are more comfortable birthing in the hospital, they decided to try and labor at home as long as possible. And obviously that's always like a little bit hard to tell, but if you can labor at home where you're most comfortable and then get to the hospital to just basically birth your baby, that is ideal, so that you have, more time there. So the next question is, ask if you're allowed to move around during labor. This is huge. Some hospitals have regulations for, like, if your water breaks, you're no longer allowed to get out of bed, which is so challenging, because moving is so important during labor and will help the baby like shift down into the pelvis and into like a proper alignment for birth. But if the mom can't move or is restricted to the bed to be laying on her back, which is probably like one of the worst positions for labor and delivery, it can really affect the process of the birth and slow it down dramatically. And then just make the mom a lot more uncomfortable as well. So ask if you're able to like get up and move around. Sometimes things like constant fetal monitoring, like, will strap you to the bed, basically. You won't be able to move, or if you have like an IV as well. And I get that sometimes those are necessary, but a lot of times they're not. So making sure that like you just know what the rules are when it comes to that, because you really are going to want to be able to like move and do your thing during labor. So important. So after baby is born, one of the big things you want to ask is if you're allowed to do skin-to-skin contact. So directly after, like literally baby is born and baby just goes right on mama's chest. That is so important for like certain hormone releases, oxytocin release, and it actually helps you bond with your baby. I did hear actually really good news that there was a hospital that actually like required that. Like they just like told the mom, like, we're gonna put the baby right on your chest, like right after you birth your baby, which is so cool to hear that. But you still want to ask. And then also after the baby is born, you want to know like what are the routine procedures done to the baby, because if you don't know these procedures, the hospital will just assume that you're going to like want to do them. So you really want to make sure that you're like aware of them and that you can opt out if you decide to for your child and you. So one of the examples of this, I probably could do a whole nother video on all of these different things, so I'm not going to go into huge detail about them, but do look them up, like do your research on them. So immediate cord cutting, like this typically happens in hospitals. They will just cut the cord right after baby is born. And there is a thing that's called delayed cord clamping, where they wait a minute before all of the nutrients are like pumped from the placenta to the baby. And some women will some people will wait even till after the placenta is birthed too, to like cut the cord. So they make sure all of the nutrients go into the baby. Super important, so look into that. The suctioning, so a lot of times in the hospital, they'll use those like little bulb suction cups to like suction out the nose and the mouth. This can actually be harmful for baby too. So babies normally can like clear that themselves, and like adding the extra suction is very uncomfortable and like a rude hello to babies. Like just shoving something up their nose to suction all that out is sometimes very unnecessary. So being aware of that. They do a vitamin K injection right at birth. I could talk about that for a long time. Make sure that you research that because it's not a vitamin. So there are potential effects to that, not as safe as some of them will make it sound. So make sure that you're researching that, and if that's something that you want for your baby. A bath right after as well. So they will just like wipe off and clean your baby. Sometimes they'll clean them with like toxic chemical soaps that can be harmful for your baby. And then they wash off the vernix, which it's that white stuff. I don't know if you've ever like seen that on a baby being born, but it is like one of the first steps in building your baby's immune system, and it should be left on the skin for a long time after they're born. So asking if you can do like a delayed bath. Some people wait like a couple days, some people wait a couple weeks. Like your baby is not, I mean, you can like wipe off like some of the blood and stuff, but like keeping that vernix on there and actually like rubbing it into their skin can help a lot with their skin, and then like their immune system overall is so important. So researching that as well. Antibiotic eye ointment, this is done like on a routine basis as well, but this is supposed to protect the baby against blindness, but only if the mom has gonorrhea or chlamydia. So if you are sure that you don't have those and you test like negative for them, you can totally opt out of this, because again, it's super uncomfortable for the baby and actually can affect their bonding with you, because they literally can't see. They put a bunch of like goop in their eyes. Again, super unnecessary if you don't have any of those diseases. So and then the next one is a big one, the hepatitis B vaccine. So this is given right at birth now, which is so crazy to me. But again, and look into that, because it doesn't really make sense once you start like learning why that needs to be given directly at birth. The only way it can be transmitted is through like shared needles, or it's like a sexually transmitted disease, which doesn't make sense for a baby to get. So moving on, those are just a few of the things, but ask them what their like routine procedures are. And this stuff is so important, because I know that like nothing can be 100% planned when it comes to your births, right? Like whether it's your first one or your fourth one, like they're all gonna look different, and there's no way you can know exactly what's gonna happen. But the more you're prepared, especially if you're going into the hospital with these types of questions of like what their rules are, and you know your rights, and what like how you're in charge and you can make those decisions. It is so important. And I know that like so many moms like just want a happy, healthy baby. I've heard that so many times, which I totally get. That's what we want. That's the ultimate goal. But the birth process really is like something that can impact the mom for her entire life. It's something that you will always remember your whole life. And if you can do your due diligence by researching these things, it really can make a better outcome for you, and give you the experience that you want and that you long for. So these things really do matter. All right, so moving on, we're gonna go to birth centers. This is a great option for like in between hospital birth and a home birth. So if you're not quite comfortable in the hospital, but you're also not quite comfortable at home, maybe birth center would be great for you. This is awesome. One of the pros about birth centers is that you have like a team of midwives for you, and they, see you throughout your entire pregnancy, during your labor and birth, and then postpartum as well. You have postpartum visits. But they collaborate with the family to decide on best care for mom and baby. So birth center midwives, and then home birth midwives as well. They trust the birth process, and they trust that it's a natural and normal process, and they support women to trust their bodies to birth babies. And that's just like a wonderful philosophy to have. And so if that's more of your mindset, then that's probably someone that you want to have on your birth team. So there's two types of birth centers. There's birth centers that are like more freestanding, like their own separate businesses. And then there's also birth centers that are affiliated or next to like a hospital. So with this, you just want to make sure that because the ones that are affiliated with the hospitals usually have to follow like hospital standards. So ask some of those same questions that you would if you were going to be in the hospital as well. And then these hospital standards like vary from hospital to hospital. So just being aware of that. A recent study found, this is so cool, that women who experience low risk pregnancies, right? And this is actually most women. Giving birth at birth centers is actually far safer than giving birth at the hospital. And I don't think most people realize that. So the national C-section rate for women in America is 32%, which is way too high. It's that's basically like 1 in 3 women are having C-sections, whether they want to or not. But it says that for women who intend to birth at a birthing center, that rate is only 6%. So much, much lower and safer because there's less intervention usually as well. So birthing centers, the rooms are typically like low tech, private, relaxing. They try and make you feel like you are at home. They're usually like super well put together, super comfortable. The beds are usually like much larger than a hospital bed so that you and your baby and your husband can like all be in bed together for co-sleeping, which is so great. And then many birth centers will also have like a rule where only like 2 women can be in labor at a time. So you have a lot more like one-on-one attention from the team, which is great as well. And then another pro is that birth centers will have like birthing balls, stools, tubs, and like different props to help the mom's comfort and to like get into different positions during labor that maybe you might not have at home or they may not have in the hospital either. So that's kind of awesome. And they're usually a little more lenient on like decorations and inspirational like items that you want to bring with you, which is really nice. That's another question you could ask the hospital as well, like what they allow you to bring. So I know some people bring like, you know, the battery powered candles or like diffusers to change the environment to be like more of like a relaxing space if they're in the hospital. And then birthing centers are equipped with oxygen and infant resuscitation equipment. And midwives are trained and prepared to use that if necessary. Midwives are also trained to see complications like arising early in labor. So if they need to transfer you, they can do it in a good amount of time, like early enough. In this study mentioned before, of the 12% of women who transferred to the hospital during labor, only 1.9% were emergency transfers. So that's awesome. So it's a very, very low rate for an emergency transfer. They can usually catch it ahead of time. And also because they are going to be like your go-to for your prenatal visits, they will be able to see if there's anything that is going to potentially put you into like the high risk category. So they'll check for like preeclampsia and diabetes, those kind of things that could maybe put you into high risk. And then they would let you know like that they needed to transfer you to an OB if needed, if it wasn't going to be safe for you anymore. So those are some awesome things about birth centers. We almost did a birth center birth for our first one because we were in an apartment and I didn't really want to like have a baby in an apartment. But then we ended up buying a home, so it was fine. So we ended up doing a home birth, but that could be a reason why too. Like you just don't want people like calling the cops or something if you're having your baby in your apartment, if you're really close to other houses. Okay, so home birth, we're gonna go into that now. This is a very personal decision. All of these are, but like if you want to do a home birth, this is obviously like a bigger decision. You really want to make sure you do your research and that you're ready, and that you have a good like support team around you. So one of the like first pros of home birth is that you don't have to labor in the car, which I've never had to do, but I've heard that it's horrible. Like contractions in the car are like way worse than anywhere else, and a lot of it has to do with like the position that you're in. But they actually say that getting in the car is like the first intervention for labor because it's going to change your environment and change the position, your position, so it can affect the process of the labor and potentially like prolong it. So that is a huge pro about home birth, is you can just stay, hang out, relax, watch a movie, like whatever you're doing in that moment that kind of helps like get your mind off of it and allows you to kind of conserve energy is super, super amazing. So I'm not one of those people that thinks that everybody should have a home birth. I don't think that it's right for everyone. I think the biggest thing is just making sure that the mom is comfortable with it. Like you want to be comfortable with your decision. if you decide you want to do a home birth, but then during it you're kind of thinking, oh, I wish that I was in a hospital, I would feel more comfortable in a hospital, then like it probably isn't a right choice for you, because that will affect your labor. If you are nervous or, you know, anxious about things, that can affect the time it takes for you to deliver your baby. So that's something to think about. Home birth significantly reduces your chance for intervention because you really just like don't have an option for it. They do have like some things that can help, obviously, with pain, but they're more like natural things. But the reason why this is so important is because there's this concept called the cascade of intervention. So basically, as soon as you get one intervention, you're going to need another one pretty soon after that, and then another one after that. So an example of that is when you get an epidural, your chance of C-section actually increases by 50%, which is huge. So just that one intervention, because you're messing with like the natural physiological process of the body, again, which can cause other problems to arise. So, yes, so that's pretty interesting. So yeah, if you're comfortable with being at home, I think it's incredible. And obviously if you're like a low risk, it's meant for low risk mamas. I had 2 incredible home births, and I want that for my mamas. It was such an incredible experience. So if it's right for you, it really can be wonderful. And it's just so nice, like having you usually have a midwife for the mom and then a midwife for the baby, and then whoever else you choose to be in your birth space. I had my mom there and then my husband, obviously. And then there was 2 other midwives, and that was it. During the entire labor though, it was really like hands off. They checked the baby's heart rate, like consistently throughout with the Doppler, but like most of the time, like it was just me and my husband laboring, and it was just a really like intimate and beautiful experience. And they do say like the more people you have in your birth space, that's how many more hours it can take to deliver your baby. So it's really crazy too, like laboring moms. Like I even remember like as a laboring mom, you are very hyper aware of who is in your birth space, and you're like hypersensitive to people's energies and stuff as well. So when you have people there, like just making sure that they are, it's hard to have someone that's like really nervous around you or having like a negative energy that can totally affect the birth as well. So being careful with who you allow in that sacred space is really important too. And that goes for anywhere you birth, not just at home. And then I want to go into cervical checks for a minute. And again, this is like anywhere you birth, not just at home, but midwives or people in the hospital, like OBs, that are gonna want to do like cervical checks regularly during your labor. I do not really see the point of it, and can actually really affect the mom and her mindset during labor. So like I was saying, mindset is huge. If the mom is, in labor for hours and then gets checked and she's only out of 4, it's just going to completely like crush her. And she's not going to really want to like move forward, right? If she's like felt like she did all this work and then like she's not dilating. That's really hard, even though she could potentially go from like a 4 to a 10 very quickly, right? So it just kind of affects the mindset. And then the other way around too. So if the mom gets checked and she's like a 7, that's like so exciting, and they're gonna like maybe say like, oh yeah, any minute baby's coming. And if it's like another 3 or 4 hours that the mom's still like trying and they check her again, she's still at a 7, that can be like really hard on the mom too, right? So because you can be at a 7 for a really long time. So it doesn't really make sense to me, because it's not really educated like guess on when baby's coming. Like we don't really know how long that labor is going to be with anybody, and it's hard to like know that ahead of time. No one really can tell you. So being aware of that, and you can opt out of cervical checks, absolutely. So with wherever you're birthing. Another misconception with home births, again, is that they're not safe. So are meant for pregnant women that are low risk, and they are very safe. The risk for intervention, again, is much, much lower, which can help you have just like the normal natural birth that you hope for. And again, it has like all to do with like the comfort of the mom, and that can really help you like relax and just be able to like open and have your baby faster. So that's really cool. One thing I want to talk about real quick too is the Bradley method course. So this was something that me and my husband did with our first pregnancy, and I recommend it to all my mamas if they've never done it before. It's geared more towards like natural birth, but really whatever your plan is, it's beneficial. So this really gave me like peace of mind. It taught me some things that I didn't actually know about pregnancy and delivery before. And it just made me feel more ready and more confident and more prepared for birth, which is something that's so important. And I loved that it involves the dad. So it really gives the dad a role to be able to support his wife through this, which is so important because a lot of dads like want to support their wife, but they don't really know what to do. And this gave them tools to be able to like know exactly what to do. And then it also helps when your husband is more confident. It helps you as well to be able to go through that process and to feel supported and like not so alone, because you can think of it more as like this is like a team effort and you guys are doing this together, which is so helpful. So I definitely recommend that. I will attach a link below so you can look into that for the Bradley method for you guys if you're currently pregnant. So we're going to move on to water birth. So I wanted to talk about this for a minute because I just think it's really interesting and something that's like a good option for a lot of people. So usually this is more common in home births and birthing centers, but sometimes you're able to birth in a tub at the hospital. It's pretty rare, but again, a lot of the times if hospitals do have tubs, they'll let you labor in it, but not necessarily like birth your baby there, which again can be hard, especially if you're getting towards transition and you're having to like get out of the tub and move. That can affect the process of the birth too. So this is called the midwife's epidural. It significantly helps with pressure and pain relief. Just from like gravity alone, taking the pressure off is so helpful. It helps relax the pelvic floor, allowing mom to relax and to open more, decreases the blood pressure. Her blood pressure decreases, C-section rate, drug intervention rate, all of those. You usually have a shorter labor because you're able to relax faster, and allows for mom to conserve energy, which again is so important. So water births are great. I labored in the tub with my son. I didn't actually birth him in the water. And then with my daughter, I was actually able to do a water birth, which was amazing. It's a really, really, really cool experience if you're interested in that. And then introducing baby. So once baby gets here, this is such a wonderful time. I think there's a misconception about how it's like a really hard time, and there are definitely like hard things about it, like there's lack of sleep and everything, but it's just such a sacred, beautiful time to have with your baby and like your new family. So really like cherish it, rest, and take care of yourself and your baby. So a really important thing to think about during this time. So like a rule I would say is like moms should focus mainly on taking care of the baby, and then the dad and other family members that are helping should focus mainly on mom and like helping with like mom's typical like duties in the house of like cleaning or laundry or cooking, whatever, like making sure that the household is running smoothly so she doesn't have to think about that and she can just focus on like feeding her baby and healing and resting. So that's super important. So this period, like the 40 days after birth, it's also called the fourth trimester. Your baby is like continuing to develop and grow. There's actually a book called The Fourth Trimester, which I will link below, which is very, very helpful for this time, and something that should be like thought about and prepared for more than it is currently, I think. So a lot of times, especially first-time moms, it's super important. They actually will look into like labor and delivery, right? That's like they're going to read all the books on that and feel prepared, which is important, but they tend to like forget about the fourth trimester, like the postpartum period, and forget to like research that and figure out how to take care of themselves and their babies best at this time. And it is absolutely essential for your healing journey so that there's just no surprises. So that's one really good thing to just focus on, like mom taking care of baby, dad taking care of mom. And just like generally, and there should be like no real schedules at this time. You're kind of just like feeding on demand, sleeping, you know, when you can, when baby's sleeping, resting as much as possible. You absolutely like need help during this time. I think that women that get more help from like family and friends have like lower rates of postpartum depression because they're actually getting the rest and they're like healing the way that they're meant to. So getting as much as help as you can. And when I say help, I don't mean like people coming over and like playing or like holding your baby, playing with or holding your baby. Like, I mean like people coming over and, you know, making you meals, like doing the laundry and the dishes and maybe playing with your other children if you have other children. And like helping out in that way. Yes, they maybe can hold the baby like while the mom naps, but that's not like the main thing that you need help with. Because baby just really needs to be by mom at this time anyways. So limit like the number of visitors you have. That's like a really good one because a lot of people just want like to come see your baby and, you know, but you really want to like make this a time with you and your family. So limit the number of visitors unless they're like helping you or bringing you food. Ask for help, ask for meals. Meal trains are really great at this time. Prepare meals ahead of time so you can do a lot of like, I'll link another book down below too. I'm totally blanking on the name of it, but it really helps with like there's a lot of meals and recipes for good nutritious meals to have that you can prepare ahead of time and freeze and then like warm up, so it's really easy for who's ever helping you to like get those meals ready, and they're still very like nutritious for you too. So I'll link that down below. So that's super important as well. So make sure you're researching this time. Let's see. In other countries, this period of time is called the sacred window. So it's that like 40 days after you give birth. This is actually very biblical as well. And it really is like, again, a very sacred time for you and your baby and your husband to rest and just like get to know each other and like what it's like to have a new life in the house. And a lot of time what happens, especially like right after birth, you're gonna have so much adrenaline because you're so excited about bringing this new life in, and it can be really easy to like push yourself too much because you feel great. But you have to be really careful because if you push yourself too much, you can actually hemorrhage and bleed out. There's a lot of other things that could happen, but they say that if you could see the wound that's on the inside of you after you deliver a baby, so after you have a baby and the placenta detaches, you have this ginormous wound on the inside of you. And if you could see that on the outside, you would slow down a lot more and you wouldn't be like, you know, lifting things that are heavier than your baby or like running around or cleaning or like preparing for like guests or whatever. Like you wouldn't be doing any of that. You would just be like chilling in bed with your baby, feeding your baby when you need to. So being aware of that, it's actually kind of a very common thing that can happen after birth because you feel good, but it's just all the adrenaline that's like pumping through your body. And so you really need to like make sure that you're resting. The general rule of thumb, and a lot of midwives will teach this, is you want to spend the first week, like 1 week in bed, which can be so difficult. I mean, you could obviously get out for like a little bit, but like you're in bed for 1 week with your baby. Then the next week, you do another week of like on the bed. So you're mostly in the bed, but you can like get up and kind of do a few things. Not a lot, you're mostly in your bed still. And then the third week is like you're around your bed. So you're taking breaks like frequently, but you're still just like pretty much around your bed in your room. again, this can be really hard for a lot of mamas. I totally get it, but it's like so necessary, and just like enjoy it, because you just don't get that time like any other time in your life to just be with your family. So that's super important. So we're going to move on to breastfeeding. This is also a very huge topic. I could probably do a whole video on, but I'll just give you guys kind of the main things. There are so many benefits to breastfeeding. It's like one of the best things you can do for your baby right away. It can be very difficult and painful at first. So I had a little bit of a hard time with it initially, and I know a lot of first-time moms especially do, but even like second or third babies, like you can have an issue with it because it can have to do with the baby as well. So highly recommend getting a breastfeeding consultant that will come and or lactation consultant come and like show you exactly like what a proper latch looks like and how to do that every time, because they'll even show you like maybe just moving your shoulder just a little bit, and that'll make a huge difference for you as well and for baby. If your baby is like constantly latching wrong and not properly, like number one, they're not going to get like the milk supply that they probably should, and it can be very painful for mom because it can create like sores on her breast, on her nipple, which that is like the most painful thing, and that can take longer to heal. So having a lactation consultant is like a must for that. Breastfeeding helps regulate your hormones, so it can actually help lower the risk of postpartum depression, which is huge. It can also help shrink your uterus back to its original size. So your uterus actually grows to 5 times its original size, and it has to shrink back down. And breastfeeding helps with that. And no one ever told me this, but this was the craziest thing. Like when you're nursing, you can literally feel your uterus contracting back down, and it actually gets this like pain. It can actually be like really painful. It feels like another contraction, like you would feel in labor. And it actually can get worse with each kid for some women. So I know that's the case for me. It was much worse with my second than it was with my first. So being aware of that, but it's good. It's like gets your uterus back to its original size, and like all your organs can get back into like their original place as well, because when you're pregnant, they just get like shoved to the side. So being aware of that, that's another reason why we have to take it easy as well. So it helps stabilize your hormones and then helps you heal through this process. So breastfeeding is awesome. If you need help with your supply, so this is a pretty common issue that women will have, is they don't have a good supply, but unfortunately, so having a low supply, like physiologically not producing enough milk, that is actually a very rare thing. So there is a lot that moms can do to like help increase their supply. One thing that is like basically confusing for moms, I think, is when you breastfeed exclusively, you don't really know how much you're producing, right? You can't really see that. And someone will say like, oh, well, if I'm pumping, then I can tell like how much I'm producing. But when you pump, you usually produce like significantly less than you do when you're actually nursing. Number one, a baby's like proper latch is way more effective than even the best pumps out there. It's obviously like the way it was meant to be. And so they're able to get usually more milk. Also, the mom will produce certain hormones when she's nursing her baby versus when she's just pumping. So when you're like holding your baby, looking at your baby, nursing your baby, you actually produce certain hormones that will help you produce more. So I think like the first question is just like making sure that you, because like some women will think that they have a low supply when they really don't, like they're producing totally enough. So as long as your baby is like gaining weight, going to the bathroom normally, then you're good. You're good. So things that can help with that though, if you are noticing that, obviously like a lactation consultant, like I said, continuing chiropractic adjustments, hydrating, proper nutrients through food, and then rest obviously too. fennel and garlic are just a couple things that can help with that. And then lactation brownies that I'm going to link a recipe for that are amazing. Anyone can eat them, not just breastfeeding moms. They're really good, but they just have like dates and oats and things that are good for milk supply. I'm also going to attach an article by Kelly Mom. She's a great resource for all things like pregnancy and breastfeeding as well. So I'll attach that too. It has some extra stuff. Postpartum exercise. So again, you want to make sure that you're resting. So at least 3 weeks of like no exercise at all, really minimal stuff during this time, honoring that time to rest and take care of yourself. If you start to exercise too soon, you can actually create repercussions that can last for a very long time, long term for you, and then potentially affect like your next births or pregnancies as well. So you really want to make sure that you're properly returning to exercise and making it more of a gradual thing. BirthFit has a lot of information on this. I talked about this, and they have stuff for pregnancy, but then they also have a really good like postpartum recovery program as well. It deals with a lot of like breathing and rebuilding not only like your abdominal muscles, helping fix like the diastasis recti where your muscles split, but then also like, you know, your full like core muscles and your pelvic floor and everything as well that need to heal from the birth process. So that's super important. And then also making sure that you're maintaining chiropractic care for yourself, especially if you're breastfeeding, just in general too, but like if you're breastfeeding, it is a full-time job. It is so much pressure. Like if you're holding your baby constantly for hours every day, it's almost like more stress on your body than pregnancy is, which is saying a lot. So continuing to get adjusted like really helps with that. I honestly don't know how women go through postpartum like without it. And then also getting your baby adjusted too. So we adjusted, my husband adjusted our babies like 20 minutes after they were born, which is so cool. And even like a normal physiological, like natural birth, seemingly normal birth, it's still so much pressure on the baby's neck and head and skull, and their spine. And so it's one of the first like traumas to the spine. And so it's like so amazing to be able to check your baby right after birth as soon as possible to make sure that their body is healing and functioning properly. And it's more of like a proactive rather than a reactive way of viewing your health and your child's health moving forward. So one of the best things you can do is get your baby checked. And obviously their adjustments are way different than adult adjustments. It's much more gentle. Some babies will like sleep through their adjustment, and you can really see them usually like relax into it, which is so cool too. So yeah, get your kids checked after birth. So important. For those of you who are patients, I actually will go out and adjust your baby at the hospital or at your house as soon as you're ready for that. So that's really cool too. So yeah, I'm so glad that you guys watched this. I tried to be as fast as I could. There's just so much information and I could go on and on about it. Yeah, I hope this helped you in some way, you know, and you can always reach out to me. Please use me as a resource. I want to be there for you. I am obviously very open about my own experiences. If you want to know more about that or any of the other like topics I talked about or had any questions, I'm here for you to answer to answer those for you. And also, if you know of any other moms or like future moms, share this with them, because if you know that they needed to hear this info too, it's important for moms to know and be like well-rounded about options that they have and how it might be different than what they expected. So, you know, my prayer and my hope is that this benefits you guys and then anyone else, that gives them like a true foundation, you know, so that they can have that amazing birth experience that they've always wanted, because I believe that all mamas deserve that. So thank you guys for watching. I love you all. And then, oh yeah, if you had any other topics that you want me to talk about in my next video, write it in the comments below. All right, we'll see you guys in the next one.